Well, I assumed office in January 2016, and probably that month, in looking at the health deficit, we did uncover the fact that contract support costs for a number of years had not been adequately calculated or paid by the Indian Health Service. And so we began to pursue that and gather data on that matter in January of 2016. And it did precede the administration by a number of years, I think about 10 years. Well, we believe that through a lot of hard work by the staff we have now, that we've corrected the calculations. And let me also clarify that it's not really a simple thing. Because we're a self-governance tribe, we do have a number of shares that comes from the Indian Health Service, and each one of those shares has an attached contract support cost element to that. And so the challenge to us was to go back and make sure that we had everything identified and everything calculated, so that we made sure that we were getting the resources that we were entitled to in contract support costs. So, you know, I got to give kudos to the staff that were working on this, the self-governance coordinator, because they did a very good job in leading that effort. If there's any correlation, it's a very loose correlation. And we can go back to the end of the Ellis administration, when there was actually a healthcare department excess. And so we knew at that time they had money reserved and put back. And so we weren't in a deficit at that point. And, you know, that's another lane that we had to work and to clarify, and through Mr. Terry and his staff, they've done an amazing job in that. But the contract support costs has been an issue that actually I knew about even before I was elected. You know, as a former Indian Health Service employee, I was very much involved in the first calculations of contract support costs back in the 90s. And so, you know, I knew kind of we had some weaknesses there. And if you don't stay on top of these tables that calculate the contract support costs, then you will not receive them. In a sense, to me, it's been kind of a personal issue, because I, you know, worked in the Indian Health Service in upper management for 11 years. And so it's been kind of tough to go back and talk to people I'd worked with and say, you guys have not stepped up to the plate. And so we started at the area office level and talking to the area director, the regional HHS office out of Fort Worth, and the secretary's office. And, you know, personally, to get frustrated by getting no answer, no response, no offer to documented deficiencies in their system that we've identified and corrected and calculated what they owed us, we had no other recourse but to take it to court. We were able to get a firm that's working on a contingency, and so it's not costing the nation anything right now. And I feel very comfortable and confident of the outcome of this case will be favorable to us. But we just, you know, we hesitated about filing. I did, because I know the folks that we're filing against, and these are people that I had worked before. But I also met with them and I said, it's a shame that you aren't making this decision, because it's in your court and you should have, you know, take care of this responsibility, and they didn't. And this formalizes the complaint, gets it into a venue where they have to respond, and so we will see this thing through. The benefit that I think the citizens will see is that it will provide us resources to do some things that we would like to proceed with. You know, it's administrative support costs, and so we've kind of had to use administrative support cost money that would normally be funded by the Indian Health Service has been funded from patient care. Now, we're not in a deficit. We've not been in a deficit situation for some time now, because we've turned that around. The contributing factor wasn't contract support costs, but it's a fund that supports the direct services. So, we want to make sure that's correct. We're corrected now. I believe we're receiving the appropriate amount that we should receive, but we weren't for a period of time beginning in 2006. And, different administrations, I think, approached it differently. I just, having knowledge of it from the outset, just felt we had to get on this. Well, having worked in the Indian Health Service, I could say I was on the receiving end of being sued for the same thing back in the 90s. We prevailed in that case because we had everything documented, and at that time the Indian Health Service didn't have sufficient money to pay that, and out of the case that was from the Portland area Indian Health Service arose the requirement that they fully fund contract support cost. Our case is different in that it's the calculation of it and the recognition by the Indian Health Service of how we calculate contract support cost. So there's been other suits, yes, so we're not the first.
The issues that we deal with and struggle with every day is that Indian Health Service, the federal government has funded Indian Health Service at about 30% of need. So every day we're struggling to have the resources to provide the level of care that our citizens deserve. So this lawsuit, going back to 2006, is us trying to ensure that we're maximizing the amount of funds that we're eligible for. So our responsibility is to make sure that we're maximizing that and to stretch those dollars as far as we can. But at the end of the day, we want Indian Health Service fully funded so that our people can be taken care of at the level that they deserve to be.
One is that we feel very comfortable that we'll prevail in the case. We have a very good firm, and for the citizens, it's not coming out of healthcare money to pay for the cost of the suit. They're working on a contingency, so if we don't prevail, we're not out any money. So this will benefit the nation and our citizens and our patients.